Hey, welcome back to another semester of nursing with the nursing professor. And so this semester, I'm actually going to focus on health assessment, which is one of the other courses that typically goes along with fundamentals of nursing. I have tons of videos about fundamentals of nursing. And of course, anytime that you have a question about a particular topic, then please drop it in the comments. I will definitely get back to you. Now, I'm not going to say to you, I'm really good at getting back to DMs, but definitely if you put something back in the comments, then I will get back to you. So health assessment. What the heck is health assessment? Health assessment is where we're actually using our skills of practice in order to determine what is wrong with our patient and what we can best do to help alleviate their problems. It is an essential skill. It is a skill that you just will continue to develop over time as you are a nurse. It's never, ever, ever going to go away. The nurse that has great assessment skills will tell you that is the nurse that makes few errors, if any errors, because they always can determine what their patient's needs are. So if we go at the top of your book, it's going to usually start out by talking about Healthy People, in this case, Healthy People 2030. Healthy People 2030 is a partnership with Department of Health and Human Services where they actually look at communities across the United States and determine what common problems exist. And so year after year after year, we always have hypertension, diabetes, obesity, all those things. And so the goal, of course, is to try to decrease the likelihood that a person will get one of those diseases. And so with that is going to be chapter number 1. Then you're going to move into a review of the nursing process. Nursing process, remember, that's ADPOD. We talk about ADPOD, we're talking about assessment. That's what we're getting ready to talk about. That is when you look at both subjective, objective information from your patient to determine what is actually going on with them. D means the diagnosis, which means we're going to try to come up with a nursing diagnosis for them. If you have an asthmatic person have a difficulty breathing, the nursing diagnosis would be alteration in breathing pattern or alteration in endurance, because it is how that medical disease is impacting your patient. All right. Next is coming up with a plan in order to help that person get back to their state before they got ill. Interventions or any actions that you do, giving medications, instructing them on diet, exercise, any of the things that you tell your patient about in order for them to return to their normal state of health. And of course, we're going to evaluate whether or not we were effective or not. Now, along with your health assessment, you're going to use two things that are very important: clinical reasoning, clinical judgment. Very, very important. What's necessary in order for you to pass your tests and pass NCLEX. When we talk about clinical reasoning, we're talking about collecting data. Again, going back to that subjective, objective information that you're actually getting from your patient. So you're taking that information in, you're using your clinical judgment to determine from what this data is that you have, that you've collected, you're determining what next steps should happen. Might be calling a doctor. It might be starting out orders that already are on the chart. It could be any of those things. So when you use clinical reasoning, we're taking the data that is given to us from your patient, those things that we assess, and we're coming up with the best decision for caring for our patient. That's what clinical judgment is. That's what the newest NCLEX is all about. In health assessment, we're going to also use our psychomotor skills, our kinesthetic skills. And people who like to perform or like to actually have action, they usually do pretty well in this class. And by psychomotor skills, I'm talking about 4 techniques in particular that we're going to use. And that is inspection, where we're actually taking a look at that patient. Look, see if there's anything that's abnormal or not. Percussion is when we actually use a tapping technique in order to determine sound, if something is dull or if it's sharp. All right. Palpation is actually feeling around a certain area to see if you can feel something that is abnormal. And auscultation is when we actually put on our ears, our stethoscope, and we're actually listening to areas of the body, heart, lungs, and even the belly. Okay, so you're going to learn all of that. Communication skills are of utmost importance when we're talking about health assessment, because what it is you need to have a conversation with your patient. Don't you go in there with no checklist and ask that patient a whole bunch of questions, because they're not going to give you the best answer, because they're going to tire out, because remember, they're sick, and also they're going to try to please you. So the best way to actually get an assessment using your communication skills is to have a conversation with them. There are lots of questions we need to know the answer to, but I tell you what, if you give your patient 5 minutes, just let them talk. Let them talk. Don't interrupt them. Don't try to be so focused on what did you eat last night, unless that is important to the whole assessment project of taking care of that particular person. So our communication is going to be therapeutic, meaning that we're trying to help our patient get better. It is an interview style where we're allowing that person to talk. We're gathering subjective information, which means it comes from the patient. We're using our objective skills is actually we're watching this patient in action, watching how they move, watching if we can determine what they say has any accuracy or not, because many times patients do want to please the healthcare provider when they're answering questions. We look at both their verbal and nonverbal skills. Many times nonverbal skills outweigh what a person is actually saying, and so we need to pay attention to that. And cultural communication. We have to consider and be respectful of one's culture. All right, because again, that is how you're going to learn more information about your patient. And so next video, we're going to talk about some of those barriers to communication that we actually have or that we make in order for the person not to be so upfront with us. So I hope that helps with the first couple of chapters of your health assessment, and I will see you next video. Please like and share this video. And if you have any questions, please comment down below and let me know so that I can further answer those questions. I will see you next video. Let's make this a good semester. Bye for now.